Imagine a world where doctors are rewarded not for the number of procedures they perform, but for how healthy their patients remain. Today, the healthcare system in many countries operates on a fee-for-service model, where physicians and hospitals are compensated based on the volume of treatments, tests, and interventions they provide. While this approach has advanced medical science and saved countless lives, it also has an unintended consequence. It incentivizes treating illness over preventing it. But what if we could reimagine healthcare entirely? What if, instead of paying doctors to fix us when we're sick, we paid them to keep us well? This radical idea flips the current system on its head, challenging us to consider the potential for a future where health, not illness, is the primary focus. Let's start by exploring how the status quo shapes our experiences with healthcare. When you visit a doctor, the system is generally designed to address your immediate concerns. Are you coughing? Let's run a test. Do you have chest pain? Here's a prescription. Each intervention, each procedure, is a line item on a bill. The more that is done, the more revenue is generated for hospitals, clinics, and practitioners. It's a model that has its roots in the early days of modern medicine, when acute illnesses and accidents were the primary threats to human health, and interventions made an immediate, dramatic difference. But as society has evolved, so too have our health challenges. Today, chronic diseases like diabetes, heart disease, and obesity are the leading causes of death and disability around the globe. These conditions develop slowly, often over years or decades, influenced by lifestyle, environment, and genetics. Preventing them requires sustained attention to diet, exercise, mental health, and social factors, all of which are difficult to address in a system designed around episodic treatment rather than ongoing care. So, what would it look like if we realigned incentives to promote health instead of just treating disease? Imagine your primary care doctor isn't just someone you see when something goes wrong, but a partner in your lifelong journey toward wellness. Instead of being paid for every test or procedure, your doctor receives compensation for keeping you healthy. Their success is measured by your level of well-being, the absence of disease, and your quality of life. This vision isn't just wishful thinking. In fact, there are historical precedents and modern experiments that point the way. In ancient China, for example, some doctors were paid only as long as their patients remained well. If a patient became ill, the payments would stop until health was restored. The implicit message was clear: true medical excellence lies in preventing illness, not just responding to it. More recently, some healthcare systems and insurers have begun to experiment with value-based care, an approach that ties compensation to patient outcomes. In these models, doctors and hospitals are rewarded for delivering high-quality care that improves health, reduces complications, and prevents unnecessary hospitalizations. Early results are promising, with improvements in patient satisfaction and reductions in costs. But how could this idea be implemented on a broader scale? It starts with rethinking the doctor-patient relationship. In the current system, appointments often last just a few minutes, with little time to discuss long-term lifestyle changes or preventive strategies. If doctors were incentivized to keep patients healthy, they might spend more time getting to know each person's unique circumstances, their work, family, eating habits, and stress levels. They could partner with nutritionists, fitness coaches, and mental health professionals, forming a care team that supports every aspect of a patient's well-being. Technology, too, could play a vital role. Wearable devices and mobile health apps can now track everything from heart rate to sleep patterns, providing real-time data that helps doctors and patients spot problems before they become serious. Imagine receiving a message from your healthcare team because your activity level has dropped or your blood sugar is creeping up. Instead of waiting for illness to strike, interventions could be timely, personalized, and proactive. Of course, transitioning to a system that pays for health rather than sickness is not without challenges. Measuring health outcomes is more complex than counting procedures. Some aspects of well-being are subjective or influenced by factors beyond a doctor's control, such as socioeconomic status, education, and environment. To address this, metrics must be carefully designed to account for the whole person, not just clinical test results. Moreover, such a shift requires cultural change, not only among healthcare providers, but among patients as well. For generations, we've been conditioned to seek medical care only when symptoms arise. Embracing preventive care means adopting a mindset of continuous attention to health, making small but important choices every day, taking the stairs instead of the elevator, choosing vegetables over processed snacks, managing stress, and staying connected to others. But the potential benefits are enormous. Shifting the focus to prevention could dramatically reduce the burden of chronic disease, saving billions in healthcare costs and, more importantly, improving the quality and length of our lives. Doctors, liberated from the pressure to see as many patients as possible, could find renewed meaning in their work, forming deeper relationships with those they serve. There are already inspiring examples around the world. In some Scandinavian countries, primary care practices receive bonuses for helping patients quit smoking, manage weight, or control blood pressure. In Singapore, a national program rewards both patients and doctors for meeting wellness goals. In the United States, a handful of innovative clinics have adopted membership models where patients pay a flat monthly fee for unlimited preventive care. And doctors focus on keeping their panels small and their patients healthy. To make this system work at scale, we'd need to reimagine how healthcare is funded and delivered. Insurance companies and governments would need to shift from reimbursing for services rendered to investing in long-term health. Employers, who bear much of the cost of chronic illness through lost productivity, could become powerful allies in promoting workplace wellness. Communities could play a role as well, fostering environments that support healthy eating, physical activity, and social connection. None of this is easy. Change is always hard, especially in a sector as complex and deeply rooted as healthcare. But the payoff could be transformative. Imagine a society where children grow up learning not just about math and history, but about how to care for their bodies and minds. Imagine elderly people living independently for longer, free from the limitations of preventable disease. Imagine a healthcare system that measures its success not by the number of beds filled or surgeries performed, but by the vibrancy and resilience of its people. To get there, we must start by asking different questions. Instead of, how can we treat this disease? We might ask, how can we prevent it in the first place? Instead of, how many patients did you see today? We might ask, how many people in your care are thriving? Ultimately, the greatest advances in medicine may not come from new drugs or surgical techniques, but from a fundamental reimagining of our relationship to health and healthcare. By shifting incentives toward prevention, we can build a system that empowers doctors to be guardians of health, not just fixers of illness. This transformation will take time, vision, and collaboration across sectors. It will require investment in education, technology, and community infrastructure. It will demand that we value health as a shared responsibility, not just an individual pursuit. But the rewards, a healthier, happier, more productive society, are well worth the effort. Imagine waking up each morning not worrying about the next doctor's visit or the next prescription, but feeling confident that your healthcare team is working with you to help you live your best life. Imagine a world where doctors celebrate not just the absence of disease, but the presence of vitality, joy, and purpose. This is the promise of paying doctors to keep people healthy. It's a bold idea, but one whose time has come. By embracing prevention, partnership, and proactive care, we can create a future in which health is not just the absence of illness, but the foundation of a flourishing life for all.